Welcome to the Royal Aberdeen Children's Hospital. Where every year,
option number one is chop it off.
more than 20,000 boys and girls from across the north of Scotland receive life-changing treatment.
Can you hear Mummy's voice, Clara? Oh, wow!
From a dedicated medical team.
It's different from Hobie City and Casualty and what you actually see in the soaps.
Coming up,
Then I have to put in here.
Ginika finds out if her skin graft is healing.
It's stuck.
A game of football leaves Liam with a nasty injury.
I slipped in the mud. My arm looks a little bit wonky.
And it's a nervous wait for Sebastian's brain scan results.
So the next 2 weeks will be the worst 2 weeks of our lives.
This is the Children's Hospital. Hospital can often be a scary and confusing place for children.
Okay.
Within the many departments, there is one small group dedicated to helping young minds deal with difficult times.
Okay.
The play specialists.
Brilliant.
I have lots of goodies in here.
Wendy has a treasure trove of props at her disposal.
So this is one of our models that we can show boys and girls. It's made out of Lego and it is a little miniature scanner.
Today, she's helping 5-year-old Sebastian prepare for his regular brain scan.
I am here for my pictures.
Can you remember the name that we call it?
MRI scan.
Fabulous.
When he was a toddler, Sebastian underwent 2 years of chemotherapy to treat a brain tumour. He gets an MRI scan every 6 months to check his progress.
So will I take it out the box?
Maybe that is just what I like.
So where do you think you're going to be when you're going to have your MRI?
There.
In what part of your body are they going to scan?
Up here.
That's right, your head, isn't it? And what do you have to remember to do?
Be really still.
That's right, so you show me you staying still. Can you do that right now? Can you practice staying still? Oh, I think you're winning. Do you remember, did Lambert go in with you?
Yeah.
Was Lambert very good at staying still?
Yeah, now it's great at staying.
To get the clearest scans possible, it's important that Sebastian doesn't move. A tough ask for an adult, never mind a 5-year-old.
To get someone of this age through this process and without the need of an anaesthetic, it's a really great achievement for them. It gives them the empowerment of being able to cope with things like that coming in and out of hospital. So we're just really giving them a little bit of support.
It has a mirror so I can see Mummy.
And where does Mummy get to stand then?
Outside.
That's it. And do I stand and touch your toes?
Yeah, you tickle my toe.
Although Sebastian copes well, there's one bit of the procedure he's not so keen on.
What do you have your cream on your hands for? Can you remember?
For all my jab in my veins.
That's right.
The hardest thing is probably having the cannula put in, because he's had jabs and things before and he knows he doesn't like that bit of it.
Beep, 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 then it comes back out.
It's stingy and it hurts.
But last time it wasn't good because there was a person who wasn't, because the doctor was
They were
not
just
good.
learning, weren't they? Yeah.
But this time I'm going to get a much better doctor, so it's not going to be that stingy.
And right on cue, Dr. Owen arrives for Seb and his MRI buddy Lambert.
I'm Owen, I'm one of the doctors. I'm quite good at this thing that you need to get done. Okay? I love this jump. Look at so who's coming with you?
Am I allowed to come as well? Yeah.
What stories do you think you'd like to look at today?
That one.
Do you know what this one is?
No.
It's called Noisy Bottoms.
Oh dear. Do you know anybody else who makes those noises, Seb?
I
Who? Anybody? Your dad does.
I think
You can do this, my
going
friend.
to.
You
Okay.
can.
And we'll roll up that sleeve.
Okay,
And then the
good
next
boy.
thing that'll come
Well
will be the
done.
needle, okay? The little cannula.
Okay.
The cannula allows contrast dye to be injected into Sebastian during the scan.
You give my hand a
Deep
squeeze.
breath.
This will give his oncologist a very clear picture of his brain.
There we go. It's all done.
Seb, you were a hero, okay? And I know you were scared, but that's what makes it even more impressive.
This is good practice for when you're a doctor, isn't it? 'Cause that's what you want to do, isn't it?
Do you want to be a doctor? Excellent.
He's got little veins, so it was difficult to find as we knew it would be, but he was really brave.
With the cannula in place, Sebastian is now ready to face his 16th MRI scan.
Do you like the rainbows?
And I also like the orange.
Yeah.
Now, Seb, are you going to come through and get some pictures done? Yes?
You're ready. Yes, I'm ready. It's been ready for a while. Oh, well done.
Excellent. In the middle. Put this over your head.
He can look up into the ceiling and he sees into the mirror, and then that means he can see his mum standing at the end of the bed, so he knows that she's there the whole time, and it means he keeps his head nice and still. You gonna wave to mum? He's still waving.
Everything alright in there, Sebastian?
MRI radiographer Daniel will take images of Sebastian's brain.
You're doing very well. We're gonna get that music playing shortly, and then it'll get very noisy.
So the first scan's about to begin. We do 5 sequences before the administration of a contrast agent, and then we give the contrast agent and we do 2 additional sequences. The contrast agent is injected into Sebastian's arm, and it's like liquid sparkles. It travels wherever there's a blood supply and lights things up. And then the doctors, the radiologists, will contrast Sebastian's images today with previous images to see if there's any changes. Scans are looking excellent. It's very rare to get such good pictures out of a child. You usually have to repeat scans where they've moved, but Sebastian has been a really ideal patient. Very happy. Well done, Sebastian. It's all over. You've done wonderfully well.
How was it in there?
Good. Noisy.
Sebastian did really well. I'm a very proud mummy right now.
Lambert was like, wiggle, 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 wiggle.
Bye, baby. See you later. Bye.
We've learnt a new word called scanxiety. So the next 2 weeks will be the worst 2 weeks of our lives. Just awaiting, you just don't know what they're going to say. And you look at Sebastian and just see how lively he is, how excitable he is. You just worry until you hear the doctor actually saying everything's stable. It is just the worst 2 weeks.
Oh, yeah.
I was wondering if you were free to give me a brief hand.
In the emergency department, 7-year-old Liam has been brought in following a sporting accident.
I fell over when I was playing football and I slipped in the mud. My arm looks a little bit wonky.
What did you say? It looks like a banana, didn't you?
Liam has just come in through our doors. He's got a very bendy arm, so we highly suspect it's broken.
Forearm breaks are the most common childhood fracture.
So I think if I just give you paracetamol and ibuprofen, it might not be quite enough.
Before an X-ray, nurses Nicola and Nikki make Liam more comfortable with an inhaled painkiller.
A couple of drops of this nostril, and then what I need you to do is sniff when I pop it in. It might make you sneeze, or it might make you have an itchy nose. Okay, so just a little sniff there. Perfect. Can you feel me touching that one? Yeah. You can't move your hand at all, can you? Because it's too sore to do that. It's fine there. And is it sore that I told you to make you sneeze? Try to hold your sore arm while you sneeze.
This isn't sports-mad Liam's first chat with the radiographer.
You had X-rays before? You have? What was that for?
Another broken arm.
Broken arm, is it the same one?
No.
No. No. Nice and still toots.
The X-ray will confirm exactly what kind of injury Liam has sustained.
Pull your side up so you don't try and escape. Okay? Then we'll go have a look at your pictures.
It said I sat still for my X-ray. And Bravery Award. You definitely deserve that one, don't you?
Absolutely.
Yeah. Good job.
The results of the X-ray are back.
So, you might be a little bit surprised to hear this, but you broke your arm.
Again?
I thought
Well,
so.
you only broke one bone this time, but he's done a good job of it again.
Emergency medicine consultant Dr. Patton is taking a careful look at the images.
We now have his X-rays back, and he has a fracture at the midpoint of his radius, which is one of the big bones in the arm. We now need to decide what to do, and we need to involve Liam and his mum in the decision-making process around that. There's lots of different things we can do. Option number one is chop it off, which is probably not the best for anybody. Okay. Option number two, make you really, really sleepy and give you an anaesthetic and squeeze it into a cast, which has a little bit of a risk with an anaesthetic.
Yeah.
But option number three, which I've got up my sleeve, is that we can give you some laughing gas and a wee bit of pressure when we get the cast on, and we can see if we can get your arm nice and straight like this one. I've been told you've had a broken arm before. Is that what you did the last time?
Yeah, it was.
Okay. This football's not good for you, is it? Okay. I've heard some of the best jokes I've ever heard when people are on laughing gas. Have you any good jokes?
It's decided laughing gas is the best option.
I'll drive, it'll be safer.
And then Mum can sit up beside you. Is that a good plan? Yeah.
You grab hold of that, and then you pop that in your mouth, and a big shook in. That's it. And give me 10 of those. That was rough. What was that?
Now it is called laughing gas, remember?
Here it goes.
Where possible, we're never going to subject a child to pain, but we will do our best to limit the amount of pain that we're causing. But sometimes you have to limit the amount of risk that you take with anaesthetics.
Deep breath.
Once the laughing gas takes full effect, Dr. Patton can attempt to gently reduce the fracture.
Keep breathing.
That's
Keep
me.
breathing. Well done.
Your arm looks straighter than it did. It's good news, isn't it? Tell me your joke.
What do you call a pig with no legs?
I don't know. What do you call a pig with no legs?
A sausage.
I can't believe you get tackled by yourself, though. I think that's just that is just priceless.
The mud tackled me.
With a cast on, it's time for another X-ray.
Moment of truth coming up. We'll see if we've got it in a good position.
This X-ray will confirm if Liam's break has been corrected enough to heal properly.
Perfect.
Right, I'm going to go and look at your pictures and see if we still need to amputate or not. Okay?
Do you know what that means? Chop it off.
Let's have a wee look. What would you do with it?
I would leave it. I think that will mould.
Yeah, we've got a good mould on it there, and about 10 degrees bend on it. Should remodel like that, and given that he's 7, he'll get away with it. I'll go and have a chat with Mum. There's 2 bits of news. It's not completely beautiful and normal again.
No.
But it's in a position that I think we can leave it in, and it'll heal up without any problems.
Okay.
Can you give me a thumbs up? Yep. Let me see you go wild scissors. Let me see them open and closing just a wee bit. This, not with that hand, with this hand. With the sore one. You're doing great. You're a chancer. Hold them out nice and straight for me. I'd say, oh, look at that. I told you were a chancer.
Yeah.
Liam may still require an operation. Another X-ray in a week's time will confirm if the procedure has worked. 3.5-year-old Ginika is recovering from a major operation to remove a large tumour from her right shoulder.
Here's my turn.
The incredibly rare tumour affects just 5 in every million people.
In the beginning, we are very scared till we don't know what is that and what is going to be. All the people who is working in the hospital, they are such a nice. They all are very good. They're very cooperative and they're very helpful. Especially doctor and nurses they are amazing.
You've got big muscles to do that, have you?
Last week, Ginika had a skin graft to cover the large wound left by the operation. A backpack conceals a pump that operates a vacuum dressing. It pulls potentially infectious materials and other fluids from the wound to help it heal more quickly.
Oh, me, it's a big place, isn't it? We're getting lost.
The family are here to meet consultant plastic surgeon Mrs. Greenhow.
So we'll see how it's looking today, if we need to put the vacuum dressing back on or not, because I'm really, really hoping this is our last trip to theatre.
The last week she asking all the time, it's too big a dressing.
Ginika has a special request regarding her bandages.
Shall we try and
make it smaller?
We'll try and make it smaller today. Okay, it's a deal.
This will be Ginika's 7th visit to theatre over the last 4 months.
She's been so resilient, she's absolutely amazing, and she's just taken so well to carrying about the little pump in her backpack. So I think she's a credit to her parents and the whole family. They've done so well. These are working. The purpose today is to have a good look at the skin graft that we put on last week and make sure that it's taken. So that's the process where the skin graft sort of sticks down onto the wound bed and makes a new blood supply so that it can stay alive. I don't think it's stuck.
Skin grafts don't always take.
Yeah, it's a skin graft on top.
Pulling back layers of dressing is an exceptionally delicate process.
Okay, so it's a bit wet and a bit mobile. It's still there. This bit looks to have taken reasonably well. So I think what we do today, we put something on that we can take off. And I don't think we need the vac. I think we just need to get it something delicate. The skin's still there. You can see the bits that look matte are the top layer of skin. Here it looks a little bit more moist, but there are still skin cells there. So Ginika asked me today if I could make her dressing smaller.
Smaller? Yeah.
Yes. She showed me that it was at her tummy button. I'm like, okay, I'll make it smaller. And the Mepitel, please. So what we're putting on now is a little sandwich of dressing. So Mepitel is silicone that's non-stick on the wound, and then hoping that it will start to look more robust over the next week or so. And certainly no plan to bring her back to theatre now that we can check this in clinics. So no more pump, no more backpack. This is all she's going to have. It can be under her clothing. So what I was hoping today, it would look like a nice normal sheet of skin, but it's just a little bit delicate, a little bit moist, but it's all there. The whole piece is there. It's just, it's not quite as robust. Like we said, it might be the case.
And it's a bag.
Looks good. So I did exactly what she asked and made it smaller. So I've just put a little bit of gauze on her back.
Thank you so much, son. Everyone needs a thank you.
Straight on.
It's been a week since Liam broke his arm, and he's back with Mum for an X-ray.
I think it's just to check that the bone's going back together as it should be, so fingers crossed. They did say that there's a possibility that he might need surgery depending on what the X-ray shows today. But yeah, he's been very brave.
Well, my friends wrote on my cast, and they said, not again.
Liam is going to be assessed by Mr. Whittaker to see if his fracture is healing properly.
This is your right arm, and on that view it looks nicely aligned, but on this view you can see that it's a bit kinked.
Yeah.
It's been bent. Kids' bones are completely different than adults.
Okay.
So the skeleton that Liam has now will be completely different in a year's time.
Yeah.
I think because it's still a fresh injury, what I think we should try and do is put you in a new cast today.
Okay.
And give the cast a wee hug and try and straighten the bone out slightly in the cast.
Okay.
Okay. You can continue your career as a football star.
You are very good at your football, aren't you?
Hi Liam, I'm Leslie. First thing we're going to do is get this cast off.
Yeah.
You remember the machine?
Yeah, you've got like this thing with the blade and then you...
And can you remember what the blade does and doesn't do?
Didn't cut you?
It doesn't cut you because it doesn't spin round and round, does it? Like a normal saw.
The cast saw vibrates back and forth. The tiny teeth cut easily through the cast without causing any damage to the skin.
That wasn't too bad, was it?
He'll be a professional footballer when he's older, he said.
Yeah? What position do you play?
Striker.
Mr. Whittaker needs to realign Liam's broken bones. It's a potentially painful procedure, so it's back on the laughing gas.
You got the giggles.
That's what we want.
Good job.
Okay, you ready, Liam?
Good boy. Keep breathing.
Keep going with the breathing, Liam. Breathe, breathe, breathe. That's
Good
it.
boy.
That's it. Come on.
Well done. Top marks. So I didn't feel too much movement there.
No.
One of the bones in his forearm is bent, but the other one is still intact. And that can sometimes act as a splint. So when you try and straighten out the bone, you're actually fighting against the one that's already intact. So it's a possibility that we haven't actually achieved much in the way of reduction, but we'll wait until we see the x-ray. We're going green, you said. Why green?
Because it's Celtic.
Celtic.
Oh my goodness.
Manchester United and Celtic.
Oh no.
Those are the teams I supported as a kid.
Daddy is going to be very disappointed.
Who's Daddy support?
Aberdeen.
Oh, there you go.
If an adult had a fracture like that, we would have to definitely do an operation to make sure that we straighten out the bone to perfection. Children compensate much better. So any deformity that is there will settle in time as they grow new skeleton.
He's a little bit disappointed, I think, that the bone's not coming together quite as it should be. But hopefully with that further pressure, that'll have done the trick.
Now this time you can see it's a bit straighter, so it's improved,
Yeah.
but there still remains a slight bend in the bone.
Okay.
At the moment, I think that's acceptable.
Liam is happy with the result, but he's not leaving without some finishing touches.
I'm going to get this pink then.
Pink?
Liam will spend the next few weeks wearing his cast and hopefully trying to avoid any more accidents.
Is that okay?
Yeah.
Is it green enough? Yeah.
Bye. This way.
It's been 2 weeks since Sebastian's brain scan, and this time he's here with Dad.
We are in to get the results of Sebastian's latest scan. He gets a scan every 6 months just to check that nothing's changed since the end of his treatments.
Hi. How are you?
Good.
Good, I'm loving your hat. You're going to be Santa's helper. Oh, yeah?
This time, Sebastian can face hospital without his emotional support toy.
Lambert, where's Lambert?
At home.
Did he not want to come today?
No, he doesn't need to. Only at like the sore bits. He just keeps him brave and not needing to be brave today.
Sebastian's tumour has been stable since chemotherapy ended in 2017. But the 2 weeks waiting for scan results is always nerve-wracking.
It's quite a nervous time at the moment. It never phases him, it's always... And we try not to let that show. So as far as he's concerned, he comes to hospital every 6 months and he gets to play with toys and the doctors make a great fuss of him. We see some pictures and then we go home and that's it for another 6 months. So fingers crossed that'll be the same today.
Paediatric oncologist Dr. Herd
Seb, do you want to come through?
is going to talk Sebastian and his dad through the results of the latest scan.
Can we take that hat off yet? No? Okay.
It's a very cool hat. Take a seat.
The cameras step back to give them privacy. The consultation is over and Sebastian and Dad emerge with news.
So you can see there, before chemotherapy, the tumour was much bigger. So this is what today's scan looks like. So the white part you can see there, that's the tumour. And this little darker patch up there, that's the cyst. The tumour is stable. With Sebi's particular tumour, it does produce a fluid. It's polycystic, so it can produce cysts. So the cyst part of the tumour, which basically is a fluid-filled sac, has got a bit bigger. But because it's not causing him any issues, they're happy to leave it 6 months. When you're in there, it can be kind of a blur. You're getting a lot of information and you're hearing a lot, and all you listen out for is everything's stable. And after you hear that, it's kind of like, oh, okay. A big wall of clouds disappear and you can see the next 6 months. And we'll get home and he'll think of questions he's not asked and he'll say, can I see my pictures, Daddy? And we'll show him. And he's quite curious about what his insides look like. So.
With the all clear for another 6 months, Sebastian now has more important things on his mind.
Bye. Bye-bye. Get away.